In this video, we'll be covering the pyramidal tracts of the spinal cord. These include the lateral and anterior corticospinal tracts. They are called the pyramidal tracts because they pass through the medullary pyramids of the medulla oblongata, which is in the brainstem. The lateral corticospinal tract sits in the lateral white column of the spinal cord, whilst the anterior corticospinal tract is in the anterior white column. Both tracts are descending, so they come from the brain and send signals to the periphery. The corticospinal tracts originate from the motor cortex of the brain, then move down through the corona radiata, which is a sheet of axons, with information ascending and descending, and the internal capsule, another information carrier. In a haemorrhagic bleed of the brain, the internal capsule can be compressed, causing a capsular stroke. This could then affect the descending corticospinal tracts. After the internal capsules, the tract then passes into the midbrain, the pons, and then into the medulla. In the lowest part of the medulla, the caudal part, the tract divides into two. The fibres of the lateral corticospinal tract decussate, cross over to the other side, whilst the fibres of the anterior corticospinal tract do not. The lateral corticospinal tract then moves down into the spinal cord and terminates at the ventral horn of the grey matter. This happens at every segmental level, and the fibres then synapse with lower motor neurons which supply the muscles. Meanwhile, the anterior corticospinal tract stays on the same side and moves into the spinal cord. They then decussate at the cervical and upper segmental levels and terminate in the ventral horn to then synapse with lower motor neurons and supply the muscles. The function of the corticospinal tracts is to provide voluntary motor control to the muscles of the body. So, if someone had an injury to the left side of their spinal cord in the lumbar region and therefore damaged the lateral corticospinal tract, what symptoms would they have, and what side of the body would have these symptoms? The person would have left-sided motor defects. This is because the tract has already decussated. A patient damages their medulla and severs the anterior corticospinal tract on the right side. What symptoms would they have and why? Pause the video if you need to. They would have right-sided motor deficits as the tract would not have decussated yet. In summary, the lateral corticospinal tract is in the lateral white column and the anterior corticospinal tract is in the anterior white column. The tracts go through the motor cortex to the medulla, where the lateral tract decussates, then into the spinal cord, where the anterior tract decussates, and they terminate at the ventral horn. Thank you for watching. Next, I will cover the extrapyramidal tracts.